2026 is upon us, and if you're turning 65 this year, listen up. If you're enrolling in Medicare this year, you have 7 months in total. That's 3 months before your birthday, your birth month, and then 3 months after your birthday. Now, it's crucial that you don't miss this enrollment window because if you do, you could be facing some penalties that follow you for the rest of your life. Now, we're not going to go entirely into the Medicare rate changes of 2026, but here are a couple important ones that I think you should pay attention to. So, just a reminder, you have your Part A, which is your hospital. That usually is going to cost you $0 a month. That's only if you work 10 years or 40 quarters. So, you either have to work those 10 years or your spouse has to work those 10 years for you to qualify for $0 a month for your Medicare A. So that's going to cover your hospital inpatient care. And we have your Part B, which is your medical care. That's going to be your physicians. If you have your labs, you're going to pay roughly $202.90 a month. That's the new rates for 2026. Now, it may be higher if you're a higher income earner, but your deductible is going to be $283 a year. So that's not per benefit period, that's per year. And then also you'll see here is a Part D, which is your drug plan. So that's going to vary on monthly costs. Some people it might be zero, even though some people are seeing that rise. So just beware. The monthly average is about $35 a month for 2026. Now, Jeremy, a big question is when it comes to the supplement plans. Because as we know, Medicare Part A and B only cover 80% of what you need when you go to the hospital.
I'm so glad that you brought that up because when people turn 65, they're hit with a massive number of choices that have massive impacts. It's financial impact. It could be an emotional impact and a physical impact, possibly. So if you think about how many birthdays you've had, how many of those had three-way tie between impact on your life going forward? Can you think of any?
I mean, I'm thinking about my 16th birthday because I finally got my license and turning 21 because I was in college. Um, but then after that, I think it's just 65.
Yeah, you're pretty much hit with 65. So there's like a 40-year gap between making some massive decisions. So you haven't had to do, some pretty life-altering stuff like you will on your 65th birthday. So here's the deal. In 2025, we're facing a number of Medicare Advantage plans. For example, there's about 42 different plans out there. On the drug front, Part D drug plans, there's 14 standalone plans. And then we have Medigap or Medicare supplement coverages that this can just leave people completely overwhelmed. Each plan is going to differ in premiums, deductibles, networks, drug formularies, and extra benefits that might be there like dental or vision. So that wrong choice can lead to some coverage gaps that can really affect you for a very long time.
And also, just to jump in here, a quick reminder that Part A and Part B, those are funded by the government. So those are government plans. And then also our Medicare Advantage and Medicare Supplement, that's coming from private insurance carriers. So Jeremy, when we're talking about private insurance carriers, we're also dealing with agents. And I know some of our clients constantly getting calls by unknown call numbers. What's the real difference between choosing, do I want to go with somebody local or a telemarketer that's calling me?
Well, I'm so glad you said that too. Agents are going to add value in several ways. There's going to be a level, hopefully, of personalized guidance because agents are licensed. They're not just going to hand you your order like at a restaurant. There's expert knowledge they have to accumulate. You've got to go training. You've got to have certification to get this done. There's a time and cost savings. And, working with an agent's usually free because the insurance company pays them. So you can avoid making costly mistakes that waste your time. There's also maybe a local insight level. So, telemarketers, they may not know what your particular situation is locally, and that's very important as well. We looked at stats, and we were just talking about this before we started filming. We looked at 2026. The number of people turning 65 is going to hit 4.1 million people. Let that sit.
Wow.
It's 11,200 a day that are trying to figure out this massive life-changing question. That is an incredibly difficult thing. And I'm going to tell you a quick story. So yesterday, I had a fellow who's 78. He just wanted to check out a few things. He knows us really well, but I think he went on the internet or made a few phone calls. And his phone, while he was sitting there, he showed me his iPhone. And he scrolled for pages however pages work, it's just scrolling and scrolling with unknown callers. And while we were sitting there in a period of 20 minutes, he had 3 calls of unknown numbers calling about Medicare. He said they will not stop. So I'm telling you, this is a shark infested water turning 65.
Yes, and something that we are seeing, especially all over social media, is the promotion of a lot of these Medicare Advantage plans. They may sound amazing, but underneath all of the extra things that you get, which they do provide dental, vision.
There could be a gym membership, like something
Yes.
like that added into this stuff. However, those extra little add-on benefits are often they sound good on paper, but in reality, they may be quite different in how you actually claim those benefits. For example, you may be subject to a network that you really don't have a lot of choices in. We see this a lot, in particular in smaller areas. A lot of times, hospitals will not want to participate with the Medicare Advantage networks because the hospitals would just go broke if they tried to serve people in those remote areas. It's the Medicare supplement is a better way to go in that particular area because they know that they can be profitable using Medicare A and B, and then using a supplement to kind of clean up whatever was left over from those original Medicare parts A and B.
I think that is a great point that you just made there is whenever you take a Medicare Advantage plan, you're actually replacing the government funded Medicare A and B. That Medicare Advantage plan is a separate private plan, while a Medicare supplement is in the name. So you keep that government funded plan and you're adding to it rather than override it with the Medicare Advantage plan.
That is exactly correct. Medicare Advantage, or Part C, was how it was originally explained, was designed to kind of be a public-private partnership so that the funds that would be used to normally take care of the medical needs, again, the doctors and the hospitals, Part A and B, are going to be funneled to a private insurance plan. The idea was to be more efficient with those dollars, and it is important to have competition. I think that's a great thing. However, in this particular case, it's resulted currently in quite a few gaps in coverage that we really should be trying to clean up. So the Medicare Advantage became more of a gap than the Medigap coverage that's currently offered.
Thank you so much for watching another video. Again, these are important decisions to be made. Also, book a meeting with Jeremy if you are turning 65. Again, you have 7 months. This is a crucial time period for you to understand all the information and what's available to you. Thank you so much for watching another video of the Retire with Jeremy podcast. Have a great day.